Hi, this is Suzanne Clegg of spiritgate.com with another answer to a frequently asked question about my octave resonance healing approach to cancer. I do energy medicine, energy healing, hands-on healing, distance healing for cancer. I train family members to help their loved ones. It could be a pet, could be a human, how to give energy healing treatments. I coach them on how to do it, how to tell if it's working, tweak their response so that they can affordably help their loved ones. And it really takes the sting out of feeling helpless because you really can take away pain, promote healing, increase the quality of life, reduce the amount of medication, and just generally make the whole experience into a healing experience rather than a pummeling, horrible thing. So anyway, my next question that I'd like to answer is, what does a cure look like? And I'd like to say that I pop off a few cancer cures every week, but that's actually not the case. Most of the people and the pets I work with live a lot longer. They live a lot more comfortably, and they eventually succumb to the cancer. And I would say that's true of my patients with heart disease as well, and of diabetes, and some of these other really chronic things. Things that people used to die very suddenly from are now being managed, and people live decades with them. I have many patients with 4-stage cancer that are seeming to just hold it. They're not seeming to get worse, and 4th stage is supposed to be where you're just getting worse and worse. You know, it's just spreading like wildfire. So are they cures? No, I wouldn't call them a cure, but are they living a good life? Are they active members of their family? Are they basically comfortable? Yeah, they are. So that's what one type of situation is that it's, you just live a lot longer, and yeah, you have cancer, but you're managing it, and without chemo or radiation is what I'm talking about. That's what I have experience with. And of course you can manage it with chemo and radiation too. That's another way to do it. But let's talk about what the cures that I've seen actually look like. So I'm thinking, if the tumor was inside the body, what happens is the tumor swells, and then it just gets kind of puffy and soft, and then it just starts shrinking. And then if my patient will do it, which they used to not do, but now I'm getting better at making sure they have to go to an oncologist. They go and get a PET scan, and they see, oh, it's gone. And that's really great because it went away without chemo or radiation. Sometimes it ulcerates a little bit and then kind of like implodes on itself and then goes down. I have another, anyway, that's usually the way it goes. I have some others, like some chronic ones going on right now that it seems like the tumor just shrinks a little bit all the time, but it's like, it's not growing, it's getting smaller, but it seems to be getting smaller very slowly. And so we agree that smaller is better than growing, and the fact that they have good energy and all that bodes well for a long, healthy, or long, happy life, at least. Yeah. So I wish I could say more, like it falls off in the shower or something like that, but it usually just sort of swells and then shrinks, kind of implodes on itself. And usually the complete cures that I've experienced, it happened pretty quickly. So that's what a cure. That's so far what the cures look like for me. And again, I don't have like thousands or even hundreds of cures. Most of my 15 years of working with cancer has been people who tried it for like 4 treatments and decided, oh, this isn't, making me immediately better, so I can't do it. And whether they were, I don't know if that was the right or wrong decision for them. It was their decision, clearly. Or sometimes I kick people out. I say, yeah, this isn't for you. Yeah. Anything else I can say about cures? Yeah. I mean, we all hope for a cure, right? Always, we hope. I always put that out as that it's documented in peer-reviewed literature time and time again. Complete cancer cures in mice. People are not mice, and if you're at the end of your normal lifespan, if you have a lot of other things going on, it's a complicated disease. It's a complicated thing. And that's where my role with my 15 years experience in working energetically with cancer comes in, because I've seen so many people not get better, and I've seen so many people get a little bit better, and then I've seen people get all better. And when somebody comes to me, I can kind of see where they're falling in that spectrum, and I can help them get to the get them over. I have more reasons to tell them, oh, you're doing it right, oh, you're doing it wrong, or try it this way and let's see if we get another response. There really are things to look at. It's not a magical, like, okay, I touched you and now you're better. It's not like that at all. It's a process, and I'm just familiar with the process. I've seen it work, I've seen it not work. So I'm the guide. I like to train my patients to do most of the treatments, or if you have a pet, I like to train you how to give most of the treatments for your pet. And we just have conversations about whether we think it's working, and how it's usually working at some level, but how can we get it to, what can we be aware of, so that if we were aware of it, we could help it along even more. And since I have like 40 years experience with energy medicine, I got a lot of things to be aware of. I got a lot of hooks to think about, and lots of ideas. And one of the reasons I love working with cancer is, well, it's the challenge of it. I like doing impossible things and having them work. But it just does seem to respond to so many of the types of energy medicines. And there's so much we can do to help. And so no matter where you are in your cancer journey, whether you're just diagnosed or you're on death's door, I would encourage you to look at energy medicine and see it's only going to help. And it can't hurt. And that's what's just so nice about it. Okay, very good. See you on the next answer to the next question.